Spondylolisthesis is a condition that can predominantly affect the lower two sections in your lumbar spine, but it can also affect the neck as well. Now, in both areas it essentially is the same process, but I'll explain it with most reference to the lower back because that's where they most commonly occur. Now, it's typically the 4-5 or the 5S1, and what it essentially is that there is one of two scenarios. Number one, there's a fracture or progressive fracture through this junction here between the back and the front part of the vertebra, or there's something called a pars defect. And you might have had this on a report if you've ever had any scans done and are watching this video. And that is where essentially when your bones are first there is a cartilage shell, and they turn into bone slowly, and they have generally 2 or more ossification centers. So this is where the cartilage turns to bone essentially. And it happens, for example, in the femur here, where we have one here, and where they meet, they get a little end plate, and those remain as growth plates through your adolescent years, and then they fuse. Now, that same process takes place in here. The problem is when there's a pars defect, that little growth plate that I mentioned, it doesn't fuse, and therefore you've got bone with cartilage in the middle. Cartilage obviously not being as strong as continuous bone creates a weak point, and that is where then the front of the bone here, the body, can start to slip forwards, and that is what creates the spondylolisthesis. Now, they're graded in a very simple manner, grade 1 to 4. 1 means it's 1/4 of the way through, 2 is halfway, 3 is 3/4, and 4 is it's all the way forwards. And in a lot of cases of the more severe spondylolisthesis, there will be some degree of conversation with regards to surgery to bolt the thing in place. But it's highly unlikely you'd be watching this video if you've got a grade 3 or 4 spondylolisthesis. The grade 1, on the other hand, is something that we do find from time to time. And it can also be a more degenerative process whereby these facets start to wear because of excess forces on them, driving that vertebra forwards. But you'll note that even on this model, because of the structure of the spine, I can't pull them forwards. It doesn't allow me to, and that's the same as your spine. Now, when something fails, things start slipping forwards. And one of the things that we see from our experience is that commonly patients will have a degree of disc bulge, and they'll have had an MRI lying down on your back, for example, and it'll say there's a disc bulge. And then when we stand the patient up and look them on an x-ray, we actually realize, oh, actually it's not just a disc bulge, that vertebra shears forwards when they stand up. And that is a different kettle of fish. It might explain why you haven't gone through the normal healing process that someone with a disc bulge might have, because there's a little bit more complexity. So spondylolistheses are a little bit more of a severe injury to the lower back, but they don't necessarily need to be a long-term problem, symptomatically anyway, if they're dealt with correctly. And you can read more on our website about the treatments that we do, but typically we're doing laser therapy to help speed up inflammation. We want to do a degree of decompression to take pressure off that spine, particularly the other joints around that spondylolisthesis. We want to establish, before doing any of that, exactly to what degree is the spondylolisthesis present, and is it stable or unstable. We also want to look at the muscles around that section with vibration therapy to make those muscles more responsive in that area and in less spasm. And finally, we have a fundamental change to the structure of your spine. So we want to make sure that all the other joints are working as well as possible. So we use spinal adjustment there to really help improve the mechanics of the rest of the spine so that it can compensate for this altered structure. And in conjunction with the treatment we do in the clinic, you've got to be doing some rehab. So we'll guide you on that process as well. But if you want to learn more about spondylolisthesis, the different gradings, etc., check out our website on the What We Treat page, and you'll be able to learn more.